Hi, Dr. Tam here from Absolute Family Chiropractic, where we try to give you all the great information every single week. I want to give you some tips, and a lot of these tips are from the current patients that we're taking care of right now. One of the patients, pregnant mommy, came in, and I think today is her 4th or 5th adjustment. Right when she was leaving, she felt a sense of relief, like she could all of a sudden start breathing better right away. And she asked me, well, Dr. Tam, how is that related to what we just did? And I said, well, absolutely, because what we just did to her spine and the adjustments that she received, we adjusted her pelvis, we adjusted her lower back, upper back, and her neck as well. We also did some muscle and tissue work along the lower back right here and the hip flexors. Well, with a lot of times with moms, and a lot of moms who are carrying little ones, you may have experienced this. Most moms will probably have experienced this, about 80–90% of you, where you felt like as the baby is sitting right in front, you felt like you're being pulled. You know, it feels like your whole body is being pulled forward. And the problem with that is, reason why it happens is because all the weight is in the front. You're trying to take care of all your little ones, and as everything feels pulled forward, you start to impinge nerves in the upper back, and everything starts to tighten up back there. The muscles tends to tighten up back here, and what happens is as the muscles tighten up, your bones can sometimes also misalign at the same time. And with those misalignments, a pinch nerve in the back, upper back, can now cause breathing problems, and you're not going to be able to take a deep breath as easily. You might notice that, wow, I'm short of breath, I feel winded all the time, and it's just not me. Maybe it's just because of the pregnancy. Well, pregnancy is one thing, but you have to know, pregnancy is not a handicap, okay? And our society has it thought it's all different. Like people who are pregnant, maybe you should lay down, and eventually you listen to them and you become bed rest and bedridden for the last 4 or 5 months of your pregnancy. It's not uncommon for me to hear that. Or a mom would come in and say, you know what? Everyone in my family, whenever the ladies get pregnant, they have shooting pain down the leg, and it's just part of what happens in my family. Well, it's not supposed to be that way. You're supposed to still be functioning. A lot of the moms that we take care of here, all the pregnant mommies that I've taken care of, they're completely functional, working, taking care of their kids, and doing everything. We had a surgical nurse mom that was working until 41 weeks, until the doctors and other nurses are saying, hey, are you okay? Are you okay? Do you need to sit down? What's going on? And she's looking at them like, I'm fine. I'm completely doing great. I'm 41 weeks, but it's not a handicap, right? So if you notice, you're a pregnant mom, and you notice that there are issues that wasn't normally there to begin with, and your medical doctor or someone tells you, oh yeah, you know what, by 25, 26 weeks, or maybe even earlier, you're supposed to feel all these issues, with you, and that's completely normal. It's just part of being pregnant. It's not true. So don't treat pregnancy as a handicap. Instead, seek out a chiropractor who will really take a look at your whole spine and get you well adjusted, and start taking care of the sciatica, the pain going down the leg. It's not normal. It shouldn't be there. If it's not normal for it to be there while we're not pregnant, why is it something all of a sudden normal when we're pregnant? Because we treat it like a handicap, okay? Hope you've learned a lot today. Have a great day.